Hello there, Dr. Brian McKay, Core Health Darien. This is it's my office name and my podcast, obviously not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. Today, I want to talk to headache sufferers. All right, if you're out there with migraines, bad headaches, cluster headaches, sinus headaches, I'm talking about any headaches. I know it sounds very general. If you want to narrow it down to a specific type, we're going to be very generalized today. I want to introduce a concept to you where you combine chiropractic care with the acupuncture technique called cupping. Now, cupping, if you go back a few years ago, Michael Phelps when he was winning all his Olympic gold medals. It was a big rage, and some people saw it, people tried it, some celebrities try it, and there's a huge benefit to cupping. Okay, well, first of all, cupping is non-invasive. It's an alternative approach to treating different things. Okay, you have muscle soreness, tightness, stress, tension in the muscle. It's going to help relieve it. Now, the downside is it does leave marks, but it's like a hickey. It goes away, and maybe it's a little uncomfortable when it first goes on. But what I found is in treating different headaches in general, what happens is you have to understand the tension is put on the muscles when the cervical spine is not supporting the weight of the head. It happens. You have to support the weight of the head. It's not happening. It goes mostly to the neck and shoulder muscles, which become tight and aggravated. Often makes it very difficult for you to sleep. Probably sleep, besides the headache pain and how it robs you of quality of life. Second thing you got to think about is how poorly you're sleeping. When you can't rest properly, you're not going to heal. So that's the one thing. And chiropractic can do a really great job of relieving headaches. But what I found is that by adding cupping to the actual treatment, it's separate, but it's part of the care I give when someone comes in with headaches. You apply the cups to basically the neck and the traps, okay, on the sides, not so much dead center from the back. So you get a few cups on the neck and the traps pretty much. And what happens is you lubricate the surface of the skin, you take the air out of the cup. There's different ways of doing it. Some people use moxibustion, where they actually take a cotton ball, put it on fire, insert it within, take the air out of the cup, place it on the skin, and it starts to create the suction. How that particular part works is as follows. The muscle cells, the tiny little cells, get filled up with garbage. Okay? If you use a muscle way too much, it's going to use more energy. Energy is called ATP. We're not going to go into ATP production today. That's a whole nother whole nother topic for another day. What happens is you use more fuel, there's more waste products, and the waste products accumulate. And most people, like if you have a tense day or a lot of stress, people say, "Oh, just rub my shoulders, it feels so good." What you're doing is you're kind of channeling out some of the lactic acid that builds up in the muscle. Lactic acid is just one of the byproducts of when muscle fuel, the ATP, is expended. So what happens here is you create surface tension on the cell wall to allow the muscle byproducts to exit quickly and easily. So it restores normal balance between stuff getting in and out of the cell wall. Always probably just picture a balloon. Just keep filling up with more and more water, and it keeps expanding. Eventually, if it's a balloon, it's going to pop. But in this case here, the muscle doesn't pop. It just starts to affect other muscles. So one muscle becomes two become three, and you have way, way more tension. And that's why in many cases, someone gets a massage, they're going to feel relief from headaches, but is it giving lasting relief? That's where the chiropractic part comes in, as I feel, and that's how I get the most results for my patients. But what will happen here is we put the suction cups on, and then we take the neck through a normal range of motion. If the head is anchored to your cervical spine with muscles on all sides. If you think I want you to picture a balloon, one of those balloons that go up like from Wizard of Oz. And what will happen is on each corner, say it's a square balloon, square basket that you're in, there's two ropes on each corner. Well, in your body, you have two muscles on each side. And what we do is we put the cups on, and we take these through a normal range of motion. The normal range of motion is a little bit what each muscle does. Some muscles will help lean the head back, tilt to the side, turn to the side. Where another muscle, same, let's just consider this, then you have same right next to you have the muscle that takes the head back, tilts to the same side, and then turns away. And so these muscles all have to be balanced out. And what I have found is that from a mechanical standpoint, the muscles that attach to the cervical spine are being overworked. And what we do is first of all, we do this treatment first where we put the cups on, we do take the person to a normal range of motion, followed by the chiropractic adjustment. One thing I've noticed is you get a much more comfortable chiropractic adjustment. People are really scared of how much an adjustment is going to hurt. And for the most part, adjustments shouldn't hurt, but at times they do. I mean, that's just a caveat, depending how tight that is. But when you do this first, the muscles are more relaxed. And by taking the muscles through a normal range of motion, you kind of reintroduce the muscle. And as you're reintroducing the muscle, normal muscle movement, you're relaxing the muscle, but it also takes tension off the cervical spine. And I cannot tell you how often someone has headaches, wicked headaches, migraines. A lot of it comes down to problems in the cervical spine, and that's where chiropractors are very, very effective. Now, I'm a little jaded because, when I get a patient in here who's had headaches for 15, 16 years, and they start getting relief after 2 weeks, you say to yourself, why can't medical doctors wrap their heads around this? I'm just saying, try it. I mean, if it doesn't work, my treatments don't work for everyone all the time. I wish they did, but they don't. But the medical profession is really not trained to offer advice on structural stuff. It's just not the thing. You need a pill. They got pills. They got shots. They have surgery, and even recommended physical therapy alone. This is taking headache relief to a much, much higher level. So what happens here is, again, you come in, you get the cupping to the muscles. We take it to a normal range of motion to release some of the lactic acid that builds up, and then we do the adjustment. And typically I would follow that up with some muscle stimulation to kind of really stimulate the stuff, the gunk, okay, the garbage in the cell to get out of the cell. And once you have that cell wall functioning properly, that's what the cups do by creating tension on the surface area of the muscle cell, and not just the muscles going to the level. You have a much better resolution. It's not unheard of to hear people saying how much better they sleep. That's probably the initial thing. But there's also other work to be done. I mean, if the cervical curve is not properly biomechanically stable, we also then do some therapy called cervical traction, which is part of it, but it's not the whole thing. And it's quite an effective package. Now, if you have questions on cupping and chiropractic care to relieve your headaches, give us a call. I mean, seriously, 203-656-3636. 203-656-3636. Nothing pleases me more than getting someone who's got chronic headaches out of pain. I'm Dr. Brian McKay, not just a chiropractor. And if I can help your headaches, please let me know. All right. Thanks for listening. Have a great day. Take care.